Next up in our speaker series, if you're just joining us, please come in. There's more seats at the front. You're more than welcome. In her role as Director of Public Policy at the National Coalition of Cancer Survivorship, our keynote speaker today is responsible for representing survivors on Capitol Hill and with federal agencies and state governments to advance NCCS's policy priorities. Prior to joining NCCS, she worked with the Texas Health and Human Services Commission, where she led and implemented critical legislative initiatives, including projects centered on CHIP, Medicaid, the implementation of Affordable Care Act in Texas, as well as providing strategic guidance and support as the senior policy advisor to more than 40 social service programs. Apart from her experience in government, she's worked with the American Heart Association and Leukemia and Lymphoma Society, where she spearheaded policy, advocacy, and partnership efforts. Her passion for cancer policy and advocacy stems from her own personal connection. Her father battled cancer from 2015 to 2017, and her mother was later diagnosed with cancer in 2019. As her parents' caregiver, she witnessed firsthand the challenges of our current healthcare system and the importance of quality cancer care. She holds a bachelor's degree in history from Rhodes College in Memphis, Tennessee, a master's degree in material and visual cultures of the past from the University of Edinburgh in Scotland, and she is currently pursuing a second master's degree in global health policy from the University of Edinburgh. Please join me in welcoming our keynote speaker for today, Hailey Smoot.
Need to shorten my bio, I think. Okay, great. So hello. First, I want to thank Michelle and Natalie and Cancer Community Clubhouse for inviting me to speak today. I'm really excited that I got to come all the way from DC to see you all and join such an amazing and impactful event. So my name is Hailey Smoot, and I am the Director of Public Policy with the National Coalition for Cancer Survivorship in DC. I found my way to the cancer space, the cancer policy space, after I lost my dad to colon cancer in 2017, and then my mom was later diagnosed with breast cancer in 2019. So I was a caregiver for both of my parents throughout their cancer experience, and I saw firsthand all of the problems that, within the healthcare system and struggles that cancer survivors and their families have to face when they're diagnosed with cancer. I wanted to try to fix some of the problems that everyone has to experience and that my family experienced firsthand so that other people wouldn't have to go through the same negative experiences that I did and my family did. So I ultimately found my way to the National Coalition for Cancer Survivorship, NCCS for short. And just to give a little bit of background about NCCS, I believe Natalie kind of touched on some of it, so I'll just give you a little bit more of an idea of what we do. So our mission is to advocate for quality cancer care for all people who are touched by cancer. We were founded by and for cancer survivors in 1986, and our founders at the time wanted to replace the term cancer victim with cancer survivor, because back in the 80s, they referred to cancer survivors as cancer victims. So they wanted to reclaim that title and become survivors, which was more empowering. And they also wanted to address the full spectrum of survivorship issues that come with living with, through, and beyond a cancer diagnosis. So as Natalie mentioned, NCCS also created the widely accepted definition of survivorship, which defines someone as a cancer survivor from diagnosis and through the rest of their life. Later, the definition was expanded to include family, friends, and caregivers of cancer survivors as well. So when we talk about survivorship, what do we mean? There's a somewhat common misunderstanding that cancer ends when active treatment ends. So you ring the bell and you're done, no more cancer. But cancer survivors and their loved ones really know better than anyone that that's just not how it really works. As Natalie so eloquently put it, cancer changes you. And most cancer survivors continue to feel cancer's impact even after they complete treatment. So we at NCCS, we conduct a nationwide survey every year called the State of Survivorship Survey to better understand all the experiences and the needs of survivors. We dive into the survivorship journey, exploring different stages throughout the cancer continuum. So that's from screening and diagnosis to active treatment and to post-treatment. In last year's survey, we found that most survivors who've completed active treatment still experience symptoms years after their treatment ends. So specifically, 74% of survivors who were diagnosed 3 to 5 years ago still experience symptoms. For those who were diagnosed 6 to 10 years ago, 69% of them still experience still experience symptoms. And then 58% of people diagnosed 10 years ago still experience symptoms after cancer treatment. So this impacts them years after treatment. Of all symptoms, survivors said mental health issues like depression and anxiety, as well as sexual concerns, are most likely to persist throughout active treatment, when active treatment ends, and well into post-treatment. They also said there were some symptoms their healthcare team just wasn't as helpful in addressing, like sexual concerns, memory loss, and insomnia. So when reflecting on their post-treatment experience, the majority of survivors said their healthcare provider discussed follow-up tests and monitoring, which is common, but far fewer talked about quality of life issues and other physical and mental health issues that they still experienced. Apart from physical and emotional symptoms, many survivors experience financial issues as well. Nearly half of survivors report that they were impacted financially and had to make employment or educational sacrifices because of their cancer care. Certain groups were more likely to be impacted by these issues. For instance, percentages are highest among young adults, survivors with metastatic cancer, and Black and Hispanic survivors as well. Unfortunately, despite the gaps in survivorship care and the lasting effects that cancer survivors experience, survivorship issues aren't always prioritized. So we see in our survey results every year that there are so many places where we need to do better. NCCS takes these stories that we hear directly from working with our advocates and from our survey to inform our efforts so that we can be sure we're focusing our work on what really matters to survivors. And policy is really where we focus our efforts. So that's what I do every day. We believe that policy change is essential to ensure survivors have access to high quality cancer care. NCCS tries to represent the needs of survivors in public policy discussions and encourage and empower survivors to share their stories with policymakers. Survivors really do make some of the best advocates because survivors have been patients. And as patients, you know better than anyone that you have to advocate for yourself all the time. You advocate for yourself with your doctors to understand your treatment options and your path forward. You advocate to get the medications and treatments that you need covered by insurance. You advocate every day. So survivors are used to advocating and fighting for themselves pretty much throughout their experience. But moving from self-advocacy and into public policy is often the next natural step and can really make a huge difference for you and other cancer survivors who are facing similar challenges. Advocates' voices truly do matter and can really help shape policy. So the government makes decisions that impact cancer survivors, and as many of us know, policymakers aren't experts in every issue area, so they look to better understand the issues that are important to their constituents. As advocates with personal stories to share, you can advocate on behalf of cancer survivors and help make policymakers understand the important issues in cancer care. Advocacy honestly can make a huge difference. We just recently experienced a major win for cancer survivors when advocates took action and spoke out against a decision that resulted in limited access to breast reconstruction options. So just to give a little bit of background, the American Medical Association and Centers for Medicare and Medicaid Services manage codes that physicians use to bill insurance providers for services. So CMS, Centers for Medicare and Medicaid Services, they announced plans to eliminate this code that would pay for deep flap reconstruction surgery at the end of 2024. So this surgery uses the patient's own tissue for breast reconstruction and is the preferred surgery for many patients because it avoids the use of breast implants or taking muscle from other parts of the body, and has more positive outcomes like reduced hospitalization, quicker recovery times, and overall better quality of life than some other surgeries. Deep flap was also a critical option for anyone who received or will need radiation treatment, say for a cancer recurrence. So as a result of CMS's decision, insurance companies can now pay surgeons significantly less for this procedure. Some surgeons will no longer offer deep flap reconstruction surgery at lower rates, and patients are either not being offered the option or they have to travel to surgeons who will perform this procedure. So we heard from some survivors who had to travel at least 15 hours by car to go from their home to find a surgeon who could perform this surgery for them. So in response, we saw a huge outpouring of support from patients and healthcare professionals across the country, as well as a lot of media coverage about the issue and the concerns that people have. Plus, we also at NCCS led a letter to CMS that was signed by patient advocacy organizations, medical professional societies, and 231 healthcare professionals across the country. The letter was accompanied by a petition where we had over 5,000 patient advocates sign and submit this to CMS. And all of this, I'm excited to say that all of this effort really did make a difference. Some insurance companies paused their decision to reimburse at a much lower rate for surgeons who performed these surgeries, and CMS announced that they were reconsidering their decision. So CMS held a public meeting this past Thursday that we attended, and this was all because of all the actions taken by the public, by cancer survivors and healthcare providers who spoke out across the country, signed petitions, talked to the media, and shared their stories. So as you can see, advocacy really can make a difference. So we're just waiting to hear what's the next step, but the great news is they are reconsidering their decision and took public testimony, which was great. So. And of course, we couldn't do that without all of the advocates across the country who really cared and took action and made a difference and made their voice heard. So if you're excited about this and you got to hear how advocacy firsthand can make a difference, and you're interested in getting involved in advocacy and learning more about policy, I have some opportunities for you to share. So NCCS has a number of ways you can get involved, and they're all free. So we have some postcards available on the CCC table in the activity room if you want to swing by and pick some up if you haven't already. We have our Cancer Policy and Advocacy team, which is also known as CPAT, and that's our advocate engagement, training, and action program that focuses on improving cancer care. We have an in-person symposium with our CPAT members in DC every June, where we have 2 days of training, and then a Hill Day where you get to meet with your members of Congress and advocate for survivorship issues. We also have online trainings and webinars where you can talk about, where you can hear about key policy issues and advocacy best practices. Many of our current CPAT members are actually coming to DC in just a few weeks to advocate for the Comprehensive Cancer Survivorship Act, which is a bill that we're really excited about that will be introduced again soon. So this bill, this bipartisan legislation, addresses the health of cancer survivors throughout the entire continuum of care. So it's from diagnosis to active treatment and into post-treatment. The goal of the bill is to really close many of the gaps that survivors face to improve survivorship, treatment, and transition for every cancer survivor. So this bill was first introduced in December 2022 it's a bipartisan bill by Representatives Debbie Wasserman Schultz from Florida, Brian Fitzpatrick from Pennsylvania, Mark DeSaulnier from California, and then Senators Amy Klobuchar from Minnesota and Ben Cardin from Maryland. So really kind of all over the country. So they're planning to reintroduce this bill this month in honor of National Cancer Survivor Month. So we also have some other programs and ways to get involved. So our Elevating Survivorship program is our program that Natalie is participating in. And it's really an opportunity for advocates and survivorship professionals to apply to be an Elevate ambassador and lead your own project to improve survivorship in your community. We offer support, mentorship, networking opportunities, virtual and in-person training in DC. And then we have resources for healthcare providers too, if you are a healthcare provider. Specifically, we have Survivorship Champions, which is our program for clinicians and researchers who are interested in improving the care for cancer survivors. We host webinars led by health professionals in survivorship care who share best practices, lessons learned, and effective models of survivorship care. You can check out our resources and get involved by visiting canceradvocacy.org if you want to check out everything that we have. So we hope that you'll get involved in advocating for change in your community, within your healthcare system, or even at the state or federal level. There's so many different things that you can do as an advocate. As I said, your experience is important, and sharing your story can make a big difference for all cancer survivors. So thank you again for inviting me to speak today. And if you have any questions, please come find me. I'm happy to answer anything that you have. So thank you.